Okay, all set.
All righty. Now, I see a face here I'm not familiar with, Reverend Bynes. Who are you?
Yes, sir. I just moved to the city of Reading, August 31st of last year. I've been having some
Okay,
issues with lead. Pastor Evelyn Morrison gave me the meeting information to come onto this meeting.
okay. So are you here to talk before the meeting starts?
No, I'm just here to observe. That's all.
Oh, okay, all right. Of course, we have a comment section where before the meeting begins, if somebody from the outside wants to make a public comment, they get the chance to do that. Let's get them, we have a quorum, I think we do.
Yeah.
The first order of business would be to approve the minutes. Now, I ended up going into AFib about 30 minutes before our last meeting, so I didn't make it. And so I can't comment on whether I read through the minutes and they all make sense to me, but if somebody who was there could approve the minutes, and then we'll second it and vote on it.
I'll make a motion that we approve minutes.
I'll
Okay,
second
is there a
it.
second?
I'll second
Okay,
it.
Kathy, and then all approved, all in favor? Aye. Any
Aye.
opposed?
All right.
Okay, then the minutes will stand approved. Inspection reports, the health officers, do you have anything to report? Or what is it? Do we
I
even have
don't
any
see
health
Char,
officers?
yeah, I don't see
Yeah, I don't-
Charlie.
I don't see
Yeah,
Charlie.
Charlie's not here yet. Well, maybe he'll show up. I didn't see, did they send you, sometimes they'll send you something separately as an addendum?
No, I
just
didn't get
on your-
anything from him today.
Okay, well then maybe he'll pop in or maybe he won't. What's new on lead abatement? I know you discussed that a bit in the last meeting.
Right,
And,
we have 4 completed units, we have 2 under contract. We have 18 Lyra lead inspections completed, and we just have 4 new enrollees in the intake process.
How,
But
the
we have
people
some
whose
completed.
houses you're going
We're
in,
Move a little quicker now.
the people whose houses you're either going in and inspecting or going in and doing, cleaning the place, and how do those people get identified?
They qualify for the program. They have to meet the criteria for HUD, under 80% of the medium income. Child under 6, the house has to be built before 1978, things like that.
Okay, so you aren't necessarily just reacting to, a pediatrician who calls you and says, my kid, got a high lead level.
Right, we're reaching out to everybody. But we do,
Okay.
like, we just had a child with an elevated blood level of 50 and was in the
Yeah, that's
hospital
high.
for a week. So we
Right.
prioritize them, and they
Right.
moved to the front of the line with intake, and we just did the Lyra, think Thursday last week. So as soon as we get the results,
Right.
and we point out, like, this bedroom has lead, move the child to this bedroom, or,
Right.
there's something in the basement we find, keep them away from that, or put plastic over it, move a piece of furniture where, to try to keep them away from, keeping their elevated blood level. We're trying to reduce it.
Now, the people who come in and do the work, not the people who do the inspections or measurements, do they have to be certified, especially certified contractors?
The company has to be lead certified, PA state lead certified. They have to have a supervisor on site, PA lead certified as a supervisor. Every worker that goes into that project has to be certified as a worker in the state of Pennsylvania. And how we monitor that, there's actually a website that you go on and check, like, all my certifications are on there. Every lead company is on there, every worker's on there, every risk
And
assessment.
I seem to remember that in its inception, one of the concerns was that they were gonna have trouble coming up with enough people who were certified, and they were gonna try to train more people. Has it been a problem getting the people to do the work?
We have, locally, we have 2 companies that went through the process and have workers and are in the bidding process. We have another one that went to class. you know, from start to finish, they gotta get, meet the criteria to become a lead contractor. And then they need to send the supervisor to training for a week. Then they gotta take a PA state test. So it's not like, you go in one day, like the worker training. It's
Right.
one day, you walk out with the certification, they give you a test. But as far as the company itself, it takes time. It's not,
Right.
we have two done and one still in the process of becoming a lead, a local lead company. But they come from Bethlehem, Harrisburg, Lancaster. The thing with Reading is we're kind of in the middle between Allentown, Bethlehem, and Lancaster. So they're each about an hour away. So we don't get, like, the guy from Bethlehem won't go to Lancaster and Lancaster won't go, but they'll come to Reading because we're kind of in the middle.
Yeah,
So
in the middle.
we're
That's
starting to
good.
get more contractors involved. I think the last bidding, we just did 2 bids last week. And then we had 5, certified PA contractors bidding on each of the houses, the 2 under contract now.
All right. Anything else on lead abatement? Mr. Henning, did you have anything you wanted to add or?
And I
Okay.
think I spoke to you, Mr. Barnes, correct? About our
Yes, yes.
program and stuff.
I fit some of those requirements I fit, like the child under 6. He was sick with the lead issue, and also the house built before that time frame.
1978.
Yeah, my house was built in 1920 or 1919.
Right, most of the houses in Reading are even 1800s to 1920. I
Yeah,
think that's, we talked about the medium income, I think, is where,
that's where I've snagged.
yeah, that's where. But did you have them tested? Your child?
Yes, I did. He had elevated levels. I have the paperwork, but I don't have it with me.
Okay.
Yeah.
Yeah, because I'd like to keep up with that, maybe we can see what we can do.
All right.
But that's what, from when I went to your house, that you could, like the windows, you were having them done, they, and as a risk assessor, you can, look and say, that's suspect,
Right.
judging by how it dries and how it, because you walk around, you can see there's suspect lead without
Yeah.
actually testing it.
And all the chips were behind his radiator. They were all over the house, really.
Right.
I have the highest levels now. I'm like in 70, I said like 70%, something like that. It was on mine, I remember seeing. And I was really sick.
Right.
Because I was cleaning up the best I could, even.
Yeah, and see, that's what we were talking about, the HEPA vacuums and stuff, because
Yeah.
they have them special filters because you're just spreading it around.
Yeah, and the guy who did the windows, he put in the contract that he knew they were lead, but I didn't know anything about lead abatement. They just came, banged out all the old windows in the front, and they didn't hang any drapes.
That's, the
It's all
dust
over
is
my
really
house.
what most people, I mean, children will eat the paint, but like you weren't eating the paint, but the
No.
dust that they created,
Right.
it's on everything, and then you eat, and that's where a lot of the poisoning comes from, the actual dust.
Yeah.
And, children will eat the paint because it's sweet.
Mm-hmm.
That's why we target under 6.
Right.
But you were probably from the dust.
Right.
You weren't eating the paint.
So I
Okay.
gotta figure something out. I don't know what I'm gonna do.
Right. That's,
Whoa, it's raining.
Hey.
It's raining.
You don't have your windows.
Anything
open.
else on the subject of lead abatement?
Do you have your windows open?
No. All right, on to coronavirus. It sounded like from the last meeting that it's pretty quiet. Anybody have anything to say about the coronavirus in the city of Reading? Mr. Stout, any issues with emergency responders? You don't have your microphone on.
I do have something from Deputy Chief Sninsky while Chief
Oh,
Stout.
yep, go ahead. Whatever you
Microphone.
have for Deputy Chief Snitsky, go ahead with that. I'm
Okay.
sorry, I don't know what I
No
was clicking.
problem. He sent me an email that COVID restrictions are all canceled and operations are back to normal.
Mhm.
That
Whoa,
opioids are still a community problem, and if the board wishes that rather than getting a COVID update, he could provide an update on opioid cases. And that the department is working with organizations to continue the Stop the Bleed training.
Yes, he's correct on all those points. As far as the department, I
Ooh,
think
lighting.
we've had one of our guys was out with COVID about a month ago, maybe a little less. And I think that was like his second round that he had it actually. But we've had no other cases within members of our department, and the call volume for specifically those who, when we were dispatched and they give the information out for the patient, whether they're positive or not, has been drastically reduced, if not almost completely eliminated. So it's been very positive as far as that.
think we can take it off our agenda for next month.
I certainly hope so. It'd be nice. It would be nice to do that. And everything else that Chief Sninsky's away, he's at the beach, and I actually threatened him not to get involved or answer the phone or do anything like that. So everything that he did report to you, Michelle, in there is up to date and correct. So
All right.
Would the board like
Alright.
me to add the opioid issue to the agenda in place of
Yeah,
COVID?
yes, I think that would be, I think it would be great getting some numbers on that. Let me
Yeah,
ask you a question. Where can the average person, should they so desire, get hold of Narcan?
well, I know that Councilwoman Hintershitz had some sort of idea or whatever, almost as odd as it sounds, like almost vending machines that people could
Right.
just get it from a vending machine. I don't know what location she was looking at. That was something through her work. I don't know exactly where we can get that. Chief Sninsky will be able to answer that a little bit more clearly. But I mean, just
Well,
to give
Doc,
you,
I don't know.
I'm sorry, just to give you an example, I don't have May stats yet. My lieutenant didn't send them to me, but in April, our members had 34 overdoses that they administered Narcan, and that's not to even count anything that may have been administered by RPD or by civilians or anyone else. But we had 34 cases, and it does fluctuate. There's some months where it's in the teens, and we've had months where it's been 50 cases, you know. So it definitely does fluctuate.
This one, maybe Dr. Schwartz would know this. Can anyone walk in a pharmacy and without a prescription get Narcan?
Yeah, actually, I was funny. I just pulled this up for you. So on the PA, just government website, there's actually a standing order. So you can just walk into the pharmacy. You actually click on this. It's a standing order. So it's not actually from a physician. It's from the Deputy Secretary of Pennsylvania, signed by her. So it is a piece of paper that you bring in and the pharmacist will give it to you. So you don't actually need it from your doctor, but you do need this paperwork. So this website is actually really user-friendly, this PA Commonwealth of Pennsylvania Guide to Opioids. I clicked right about how to get the prescription myself, and it took me right to the link.
Okay, I thought there were special provisions to get them, but I wasn't sure.
Yeah.
All
Yeah.
right.
There's the standing order, but they are also now available over the counter. And you can also get them for free through Coca. It's a part of their website. You can contact Coca and pick it up either at the Rise Center or at the Centro Hispano. You can also complete the form on their website and get it mailed to your home.
Yes, I believe that's where Councilwoman, if I'm not mistaken, I believe that's where she works with.
Yeah,
Coca
she
at the
works
Rise
with
Center.
Coca.
Yes,
Yeah.
I thought so. Okay.
Yep. And
And I
actually,
wonder, I mean,
Mhm.
since I'm asking this question, I should know. You wonder how many people in the city know that they can do that, and trying to get some information out about that. I mean, or maybe everybody but me knew that. I don't know.
But I'm sure more know about it than you think, because I know a lot of times when the events do happen and our paramedics pull up, or our firefighters and medics pull up, those people there said, oh, we already gave them 1 Narcan or 2 Narcans or something like that. And depending on what they took, sometimes it takes 3 or 4 rounds just to bring them out of there, especially if whatever they took was laced with something. So it varies, but I think the public is aware. I'm just not sure if they're aware of everything that goes with it. And, obviously
Right.
there needs to be, more education as far as the dangers of the use, but that's not for us. We don't have a magic wand to take care of that situation.
Yeah,
Right.
but Coca runs radio and print advertising for it, and so does the SOS Berks, the opioid coalition. So that it's out there, but it's kind of a niche. It's not marketed broadly. It's marketed at like health centers and treatment facilities and things like that. They do run an ad on some of the buses have it. So
Yes.
you can see it, but you kind of got to be paying attention.
Okay. That's all
All
I
right, on
have.
to
as far
old
as-
business.
No, go ahead. I'm
Okay.
sorry.
No, fine. Old business, the county health department, as you know, that's come up, and I don't know if there are still talks underway. I saw something in the minutes from last meeting, which I was curious about. And that is, they talked about the toxic E. coli that they had to break out on. And somebody made a statement that if we had a health department, that would get reported to the health department. But to say that we don't have a health department, I think is a bit of a misnomer. We actually have a health department. It's run by the state, and it's on Cherry Street, and it covers both Schuylkill County and our county. So wouldn't things like that get reported to them? You'd think there'd be some central clearing area where people would know if, the spikes or of these sort of things are showing up. I don't know. Dr. Schwartz, if you had something really strange come in your office, like measles, what would you do?
And so I was just thinking, so, again, like you said, any lab that would trip, automatically gets reported to the state, like I don't have to do anything there. If honestly, except if I wanted to report anything above that, I would probably use our infectious disease contact to contact the state. So I don't think it's very clear, exactly what the pathway would be.
And you would think that if the ID people bumped into one of those cases, they would be all over.
Yeah.
Those people, if there's one ID case in the hospital of,
Yeah.
Tsutsugamushi fever, they're going to know about it.
Yeah.
Anything else new in the health department discussions that anybody's aware of?
No, that's like, I think it gets kicked right to the state. That's where people don't think there's a Berks. I think the state office is on Cherry Street, but I don't think it's technically like Berks County. I think that's why.
Oh, no, it isn't the same as if we had our own, because in the
Right,
beginning of
that's why
COVID, when they wouldn't release information to us, I got on them and I talked to lots of people. And it's a long story if you want to hear it. But they
Right,
said,
that's
we
right.
do have a health department, but I'm not sure what they do. Oh, okay. All right. How about, I know, is there anybody here today to talk about the health survey? Appears not.
No, I believe they said they'd have their next update for us this summer, so I'll invite them to the next
Okay.
meeting.
All right. And then that goes on to the subject of health board amendments. We've passed some. Are there some that are still, there's some that still need to be presented to us for review and approval to be passed on, I presume.
That's correct. And Fred just connected to the meeting. Fred, I don't know if you have an
I saw
update.
that. He was driving his car. It looked like he was in the rain.
Sorry about that. Yeah, I lost track of time. I was on the phone with our other solicitor about current events. But yeah, no, I don't have an update unfortunately right now.
Okay. Now, as far as new business, I think the one thing we need to talk about, I'm happy to see that Dr. Schwartz is here today. As you probably know, Dr. Schwartz, we lost Dr. Kelleher. And her replacement down there, she had indicated that her replacement might be interested in taking a role in the board. I think a person like that would be perfect because, you know, unlike me, but you and even more so, these people, they're down treating the inner city people.
Mhm.
And so it would make sense. And Michelle's going to reach out and try to get hold of that person. If you even just get the name, I'll just literally walk. I mean, it's a couple blocks from my house. I'll walk down and knock on the door and see if she's there.
Okay.
I'll be happy to do that.
Yeah.
So that's
No, I
what we
think
want to do. And I appreciate.
Yeah.
I appreciate your coming around, Jessica, Dr. Schwartz.
Yeah.
All right. Do you treat any pediatric? Do you do any peds, Dr. Schwartz?
I do not.
Oh, okay.
And
Because I was
I'm
going to ask you
good at
about
that.
test lead in kids, and then it was like, yeah, sick kids are something else.
There's something
sick
else.
kids scare
So,
me. Yeah, they
so
scare me.
I agree. I think having somebody else from Berks Community Health Center would be a great representation and somebody who does, pediatrics.
Okay. All right. Is there anything else? I think that's all the business that I had for today. Does anybody else have anything for the good of the order they'd like to discuss? I looked at the map. It looked like there was like a 2-mile square area there. It got drenched here, but nothing else. So my lawn
Right
got
over
watered a
City
bit.
Hall right now.
Oh, is it? Yeah. I know that, what was it, about 4 or 5 days ago, we had some thunder. We had nothing, but one of my friends up near Mooresville said, oh my God, they had, in 15 minutes, they had 1.5 inches of rain or something.
Mhm.
Some people are getting lucky, but boy, you go through the farmland and the corn looks sad. All right, well, if that's it, then can I have a motion to adjourn the meeting? Oh, I guess well, our next meeting would just be the first Tuesday in,
Don't be heard.
what would that be?
We get it in the minutes.
August
I'll make a
2nd.
motion, we adjourn.
Hang on a second, before we adjourn,
Great.
so the next, the first Tuesday in August would be Tuesday 1st. The first, so we'll pencil in like that. I know we're getting into vacation season and whatnot, so if we have to move it or cancel or whatever, we can always do that. But I guess we'll put it there for the moment unless a whole bunch of people find out soon that they're gonna have issues with that date. Okay, all right, now who is gonna give us the motion for adjournment?
Move
that
to
Bob?
adjourn.
Second,
I second.
all right, all in favor? Aye. All right, we'll see you in 2 months.
All right, bye.
Everybody have a good evening.
See ya.
Thanks for your help, everyone. Appreciate it.